once you enter the room of addiction, I know you mentioned, a number of different types of addiction, from pornography to gambling, alcohol abuse, substance abuse. Is it easier just to move from one to the other, or do you find that, certain individuals have certain addictions and that doesn't lead to moving into, going from alcohol to pornography, or going from alcohol to gambling? What's that journey like for an individual? Like, how segmented is it, or how joined up can it get?
So about 50 to 80% of addiction presentations are complicated by some other disorder. So it's unusual that it's more often than not we get what we call comorbidity or dual diagnosis. And in many cases, it's polydiagnosis. So, for instance, there may be, say, an alcohol problem combined with depression, combined with the use of over-the-counter codeine to aid hangover. In addition, there may be some cannabis smoking as well. And, so there's potentially 4 things going on there. There could be overuse of the phone as well, and some gambling. So, really our job in the first instance is, so much of it is assessment, So I would, with regards to people coming into the service, I would see people, I always see people first with a view to assessing where people are at, what the different needs are, and of course risk assessment as well. Now that's not an issue in many cases, but it is for some. So I'm talking about, if somebody has issues with self-harm or suicidal thoughts. But generally, it is from the outset, it's assessing that exact issue that you're describing. It's the different disorders. Now, the movement between different disorders is something we see as well very often in terms of what's called substitution. So if you come off one, if you withdraw from, say, alcohol, the likelihood, if you're in recovery from alcohol addiction, that you may use other substances as a means of dealing with alcohol addiction cravings. And similarly, if you come off some other substance, then you may look at another process, another behavior, or another substance in its place. So very, very common. That crossover, say, between alcohol and benzodiazepines is very common. So anxiety would be a very prominent feature of alcohol, alcohol withdrawal or post-acute withdrawal, which can go on for months. I'm talking about months after somebody maintains abstinence. So, the use of benzodiazepines there can then lead to an addiction, similarly with codeine. So that substitution is common. We would also see substitution. I mean, the most common relatively harmless one is eating chocolate. People's use of chocolate goes flying up. The other one is smoking cigarettes, and we've looked at that actually in terms of in-house, the rate of cigarette smoking or reinitiation of ex-smokers becoming current smokers. And then there's the whole spectrum of behaviors. So it could be, engaging in relationships as a means of distraction, so emotional bonding in that way, or it could be a sex component to that. Or, ideally what we want people to do is engage in adaptive responses as opposed to maladaptive responses. And, generally there's a clear line between adaptive and maladaptive. But again, I suppose there's a slight issue there with, how do you define adaptive and maladaptive in the context of process addictions or excessive behaviors, So, and that ties in with workaholism and people who are supposedly working too much. But it's difficult to define a work addiction. But again, if it's causing harm to the individual, so to get back to adaptive and maladaptive, really it's about causing harm. If there's harm to the individual, that's a problem, and if it doesn't, then you're okay.